You're listening to KSG Podcast. This is a short, crisp, concise, exam-oriented, edited editorial for civil services aspirants. In this podcast, we are going to talk about traditional medicine. Source for the content is Kaunain Sharif M's article for the Indian Express. Prime Minister, along with World Health Organization Director General Dr. Tedros Ghebreyesus, was performed the groundbreaking ceremony for the first of its kind WHO Global Center for Traditional Medicine, that is GCTM, in Jamnagar, Gujarat. Earlier, the Prime Minister had said the GCTM would go a long way in enhancing wellness in the society. Now, what is traditional medicine? The WHO describes traditional medicine as the total sum of the knowledge, skills, and practices indigenous and different cultures have used over time to maintain health and prevent, diagnose, and treat physical and mental illness. Its reach encompasses ancient practices such as acupuncture, Ayurvedic medicine, and herbal mixtures, as well as modern medicines, the WHO says. Traditional medicine in India is often defined as including practices and therapies such as yoga, Ayurveda, Siddha that have been part of Indian tradition historically, as well as others such as homeopathy that became part of Indian tradition over the years. Ayurveda and yoga are practiced widely across the country. The Siddha system is followed predominantly in Tamil Nadu and Kerala. The Sowa Rigpa system is practiced mainly in Leh Ladakh and Himalayan regions such as Sikkim, Arunachal Pradesh, Darjeeling, Lahore, and Spiti. Now, what will the GCTM be about? On the 3rd of November 2020, Dr. Tedros announced the establishment of the WHO GCTM in India. The Union Cabinet in March this year approved its establishment in Jamnagar with the signing of a host country agreement between the Government of India and the WHO. India has committed an estimated $250 million to support the GCTM's establishment, infrastructure, and operations. The GCTM will aim to focus on evidence-based research, innovation, and data analysis to optimize the contribution of traditional medicine to global health. Its main focus will be to develop norms, standards, and guidelines in technical areas relating to traditional medicine. At press conference on the 18th of April 2022, the Ministry of Ayush, that includes Ayurveda, Yoga, and Naturopathy, Unani, Siddha, and Homeopathy, Ayush stands for all of these, said it will seek to set policies and standards on traditional medicine products and help countries create a comprehensive, safe, and high-quality health system. The GCTM will support efforts to implement the WHO's traditional medicine strategy, which aims to support nations in developing policies and action plans to strengthen the role of traditional medicine in pursuing the goal of universal health coverage. According to WHO estimates, 80% of the world's population uses traditional medicine. Now, why has the WHO felt the need to advance knowledge of traditional medicine? The WHO says 170 of its 194 WHO member states have reported the use of traditional medicine, and these member states have asked for its support in creating a body of reliable evidence and data on traditional medicine practices and products. It says the Jamnagar Center will serve as the hub and focus on building a solid evidence base for policies and help countries integrate it as appropriate into their health systems. The WHO has flagged many challenges faced by traditional medicine. For instance, national health systems and strategies do not yet fully integrate traditional medicine workers, accredited courses, and health facilities. Second, the WHO has stressed the need to conserve biodiversity and sustainability, as about 40% of approved pharmaceutical products today derive from natural substances. The WHO says, for example, the discovery of aspirin drew on traditional medicine formulations using the bark of the willow tree. The contraceptive pill was developed from the roots of wild yam plants, and child cancer treatments have been based on the rosy periwinkle. Now, third, the WHO has referred to modernization of the ways traditional medicine is being studied. Artificial intelligence is now used to map evidence and trends in traditional medicine. Functional magnetic resonance imaging is used to study brain activity and the relaxation response that is part of some traditional medicine therapies such as meditation and yoga, which are increasingly drawn on for mental health and well-being in stressful times, it says. Fourth, the WHO has said traditional medicine is also being extensively updated by mobile phone apps, online classes, and other technologies. The GCTM will serve as a hub for other countries and build standards on traditional medicine practices and products. That's it for this podcast. Thank you so much for listening. To join KSG India courses and to crack the ICE exam, visit ksgindia.com. You can also get a PDF of this podcast on ksgindia.com.